Right now, though, back to the Johnson & Johnson vaccine, once it's approved and shipped, it should dramatically boost the overall vaccine supply in the country. But the question we asked in our last segment, should people line up for it, or should they wait and get the Pfizer or Moderna vaccines? With us now is Dr. Richard Seidman, Chief Medical Officer of LA Care Health Plan. Doctor, thanks for being with us.
Thank you. Pleasure to be here.
So, as we did point out, I don't know if you heard our first segment, but I think all of us probably have now encountered some people who say, I'm going to wait for Johnson & Johnson because it's only one shot. I don't have to go and get two. Then there are other people who are doing the opposite, and they're going, well, I look at the numbers, and it seems like, the Pfizer and Moderna ones are somewhat more effective, so I want those. What should people do?
Well, I agree completely with Professor Fuller, who you had on a moment ago. People should get the first available vaccine appointment they can get. They're all highly effective, and we need more people to get immunized as quickly as possible to try to bring the pandemic under control.
In practice, how do you think this works? Since it is easier to handle, do you see the Johnson & Johnson vaccine, if approved a couple days from now, going to the pharmacies or going to health clinics because it's easier to not be, sub-zero refrigerated? If the county and the city sites can handle Pfizer and Moderna, it seems like they're doing fine, then does J&J go to other spots?
I think there will be some customization of the distribution, particularly for really difficult-to-serve populations like people experiencing homelessness. So our street outreach teams and home health nurses doing home visits for vaccination, the Johnson & Johnson is definitely much easier to handle, and it should go there. But as Dr. Fuller said, today demand so far exceeds supply that as much supply as we can get in all of the different vaccine providers, the better. And again, the overall message to the public is get the first vaccine you can. Down the road a couple of months when vaccine supply is much more available and time has passed and there's fewer people out there scrambling to find the limited appointments, people may have a little bit more choice at that point. But right now, the eligibility and demand far exceeds supply. Keep on those websites, be patient and persistent, get the first appointment you can for any of the approved vaccines, and we'll all be a lot better off.
Well, and I suspect, and tell me if I'm wrong, I think that lay people, non-medical people, interpret incorrectly these efficacy numbers, and that doctors like yourself use them in a different way. By that I mean that a vaccine that's, say, 95% effective, the Pfizer and the Moderna one, say, does that not mean just that about 5% of people will still come down with some sort of mild, perhaps, COVID infection, but aren't, as I asked the professor, aren't all of these vaccines extremely protective against more serious outcomes like hospitalization and death?
Yes, you're absolutely right. And that's, if you ask me to quote one number, the overall message we need to get out to the general public is that the Johnson & Johnson vaccine has been entirely effective at preventing those most serious outcomes of hospitalization and death. If you want to know what's most important, of course, we'd like to prevent as many infections as possible, but mild to moderate infections are just that. They're mild to moderate. You may have fever and chills and other symptoms. There are certainly cases of the long haulers where people have had persistent symptoms, and I wouldn't want to minimize that. But at the end of the day, the most important outcomes we're trying to prevent are severe disease, hospitalizations, and deaths. And the Johnson & Johnson vaccine is highly effective at preventing those most serious outcomes.
Lastly, I've got to ask you, because Mike and I have been talking about this. We have a story coming up later about commuting. Do you miss commuting?
I do not.
See, Mike? Nobody misses
and
commuting.
He's a doctor.
Nobody
we can trust him. Dr. Richard Seidman, Chief Medical Officer, LA Care Health Plan. Doc, thanks.